Like, it hits so deep.
A grieving daughter.
She had no reason to die. Mama nale sharp.
Shirley's mother was admitted for mental confusion at the Chris Hani Baragwanath Hospital early June.
So I wanted them to help her with that.
After a brain scan, she tried to inquire about her mother's condition.
I kept on calling, asking for a doctor. 3 weeks passed. I haven't received any call from a doctor.
Anxious and worried sick, Shirley went to the hospital early this week.
Got 6, it was a Monday. I decided, no, like, let me just bath and go to Kopara.
She waited for over 4 hours while a staffer tried to locate her mother.
She said I should describe my mother. I described my mother. I showed her a picture. Then she told me to sit down. I did like ofati. And then I tried this other book. So I'm sorry, your mother died. Saturday at 12. I celebrated my birthday Sunday the whole day without knowing my mother is no more.
But what pains her more is the presumed cause of death.
And she told me that if she were to conclude, she would say that my mother died of COVID-19 because she was only confused. There was nothing else on her body.
Told to go to the hospital with an undertaker. To their shock, the cause of death changed.
Now they've changed the statement. They're saying that my mother has died of high blood pressure. She did have high blood. It was under control. And I still don't believe high blood. I went there myself on Monday. They told me it's COVID-19. And now they've changed. They're saying high blood.
There would be some uncertainties that we might not be able to actually to understand at the moment or actually explain, but it might also be helpful to deal with the matter as per case so that we know exactly what could have transpired with the patient that is actually referred to. But the COVID disease, as a disease entity, has got a lot of manifestations that some of them we still discover as we go.
Another family wants answers. Nomalanga Mguni's father was admitted to Tembisa Hospital last Saturday.
He can't breathe properly.
The family says they were told his condition was improving, but on Tuesday they called in vain and could not get an update on their father's health and COVID-19 test result.
At 9:22, I get a call. Is it possible that you can rush to the hospital? When I got there, the doors were open. I got inside because there was no one there. I saw patients that were not dressed. They were crying, and not even blankets.
A nurse broke the news to them.
One came to talk to us and told me that my dad has passed on at 9. We were not even allowed to see the actual results. What made him to be critical? I want to see the reports they were writing because they told me he was okay, he's fine. I want to know why was he in Ward 16 with people that have tested positive if his results were not out.
Still unsure if he succumbed to the virus.
Team from the MEC's office, and also we also learned that the ombudsman, the health ombudsman, has been to Tembisa to also do some investigations in that regard. The most important aspect that we also have to do with and deal with as the department is also how we communicate with the families of patients that are admitted in our facilities.
Investigations are underway. The aggrieved families hoping for justice and closure. SABC News, Johannesburg.